Hi, I'm Elizabeth.
Hi, I'm Pauline.
Nice to meet you.
Okay. So, Miss Elizabeth, we're gonna go ahead on our business of the day. So, we're gonna start the interview.
Okay.
So, could you please tell me about a time in clinical at FTTC in which you delivered high quality patient-centered care to individual, family groups, and community in varied settings? And how did these examples meet objective to the patient?
Yeah, so the first semester during fundamentals, I was put on 3 North over at Cape Fear Valley, and that's a nephrology floor. And I remember one of the patients I had, it was her birthday, and she didn't have any family or friends nearby. And I collaborated with the nurse I was working under, as well as another RN on the floor and one of the CNAs to make her day special. We gave her a bath. I was able to braid her hair for her in a style that she wanted. Also, one of the CNAs gave her this really floral, nice smelling lotion, and we just really made her day special. And it wasn't necessary, and we didn't need to do it, but we did that to offer her high quality patient care.
Okay, perfect. Tell me how you use something you learned from one of your class assignments to incorporate best practice and professional value and style into compassion nursing practice. Did this new knowledge really help the patient? Why and why not?
Yes, so the first class that we took, the fundamentals class, we had a group project, and it was all about the community resources. And I remember one of the portions of it was focusing on the elderly community. And during my clinicals that semester, I had an elderly patient who required his doctor asked him to start exercising more for his health. And so I was able to utilize that information I learned for that group project to teach him about the local parks and recreation centers, such as the Tokay Fitness Center. And it was really beneficial to him because he was able to go get the exercise that he needed, and I was able to utilize that information to his benefit.
Okay. Move to the next question. Tell me an example of how you demonstrated cultural and global progress in the healthcare environment with the diverse population in promotion of health lifestyle and preventative health screening at clinical and FTTC. Did comparating these cultural really help patients in patient discharge information and education?
Yes, so when I started nursing school, I decided to join the ANS, and I became an officer for them. And one of the community outreach programs that we decided to do was providing education to the local homeless in our community about the COVID-19 vaccine. We were able to, provide them with education as well as give them the vaccine as well to those who decided they wanted to receive it. So I feel like it was really beneficial in helping our community and also serving multicultural, people from different backgrounds,
okay,
all different backgrounds.
Okay. Describe a situation in SIM or clinical at FTTC where you function as an effective member of healthcare team demonstrating excellence, interprofessional collaboration, and what are some of the skills did you use to achieve that goal?
So recently in our class, we actually had a sim experience where we were faced with a mass casualty event, and we were doing reverse triage, so like tagging patients based on, the priority that they were needing to be seen, which was really helpful for us to learn how to communicate and collaborate well as a team. Also, we were able to learn how to practice delegation. And we also practice playing the role of the family member who's receiving that devastating information of their loved one passing. And we also practice being the nurse to break that news to the patient. It was just really beneficial in helping us learn how to communicate and present the information as fact. And so the second part of that question, some of the tools that we used were the SBAR handoff, situation background assessment recommendation. We also used, just our ability to delegate and work well as a team to collaborate and communicate with each other to handle it.
Okay. Describe how you have demonstrated the beginning skills in point of care leadership, management, and care coordination using effective communication skills through either successful completion of class project or a clinical situational experience.
Yeah, so during one of my clinical experiences on a med-surg unit, I had a patient who actually had a right lobectomy. So she had it removed, and I remember looking in the chart, and multiple nurses before me had documented that she actually, they were hearing clear, diminished breath sounds, and so that was interesting to me because I didn't hear anything on that side, and so I went to my clinical instructor as well as the nurse, and we found out that she actually didn't have that lobe. And so I learned the hard way that you really have to do your own research, you have to do your own work, and you can't look at what someone else has documented, and you need to kind of make that hard step and make sure that you're providing quality patient care by making sure that you do your own assessments. And so I learned the hard way that you have to do your own documentation, and I think doing that is what is going to help the patient ultimately in the end.
Okay, how are you planning to strengthen your leadership skill now, because now you as a nurse?
Yeah, so I remain up to date. I use up to date to remain current in all the information that's the latest, and I also do research through Medscape. I'm not sure if you're familiar with them, but they're just the most recent information. I also make sure that I remain a member of my, the ANS, but also the NSNA. I plan to remain a member of that as well, to completely be able to practice my leadership skills and have the most current information as a nurse. And I also do plan to pursue my BSN after I begin working.
Describe how you implemented safe and competent care to individual through both system effectiveness and individual performance in varied healthcare settings.
So definitely making sure I'm practicing the basic safety needs, like hand washing, using the ABCs and Maslow's hierarchy of needs. I also make sure that if the patient might be immobile, I make sure they have socks on with the rubber floors, that they're it decreases their slipping and fall risks. I make sure to go through a medical history and review their chart and review their information to make sure I'm practicing safe care.
Okay. Tell me about a specific clinical situation in which you identify something unsafe to a patient and what you did about it then and why. Looking back, would you change what you did then? Why or why not?
Okay, so again, another situation where I saw kind of how to not do something. Last semester, I was on a oncology med-surg unit, and the nurse had prepared the medications ahead of time before I even came in the room. She had this little cup filled with all the pills, and she's like, "Oh, you can go ahead and give these to the patient now." And I was like, "I'm sorry, ma'am, I didn't witness you pulling those pills. I don't know what they are, and I don't feel comfortable giving them." And so it was uncomfortable, but I think I did what's ultimately best for the patient, and I practiced safe care, and I feel like that really helped me to learn how to have that confidence. And would I do the same thing? Yes, I would do the same thing again. And I think that learning the hard way to just have that confidence and ultimately just being an advocate for the patient is what's going to help them the most. So.
Okay, thank you so much, Miss Elizabeth. That's the end of our interview.
Okay.
So we will just keep looking at your email in a few days. We will still look at it to see whether you can work with us. It was nice to meet you, and thank you so much for your time.
Nice to meet you too.
Okay,
Thank you, Colleen.
Okay,
bye.